Good morning, good afternoon, good evening, dear colleagues, dear friends. It is my great pleasure to welcome you all today. My name is Irina Pinchuk. I am Professor of Psychiatry, Director of Institute of Psychiatry Taras Shevchenko National University in Kiev, Country Director, International Technology Transfer Center, Ukraine, and Head of ISSUP Ukraine National Chapter. I would like to announce today the webinar Provision of Addiction Treatment Services During the War in Ukraine. Today's webinar will be devoted to the specific of the implementation of project and national program to support opioid substitution therapy and HIV during the war in Ukraine. We would like to dedicate this webinar in memory of our dear colleague, Viktor Kolomiets, who passed away so early and contributed so much to the advocacy, establishment, and scaling up HIV and substance use treatment in Ukraine. This webinar aims to bring together Ukrainian experts and the international community of mental health professionals to discuss the current state and key issue of providing psychiatric care to the population using psychoactive substance during wartime. The war has a negative impact both on the structure of the provision of the psychiatric care and of the mental health of the person who needs it. The occupation of cities, damage and destruction of infrastructure as a result of the massive artillery and missile attacks by the Russian Federation on the territory of Ukraine had a significant impact on the provision of assistance to the population using psychoactive substance and of the structure of the psychiatric assistance in general. So it is my honor to introduce my colleagues, Olga Gvozdetska, Acting Deputy General Director, Public Health Center of Ministry Health of Ukraine, and Evgenia Zakrevska, Program Manager from Alliance for Public Health. I would like to inform the attendees of the webinar that you can send us your questions in the chat during the presentation. After two presentations, we will have a discussion. Please find the chat in the GoToWebinar control panel. If time is not enough, questions by email are welcome. Now our first speaker, Olga Gvozdetska. Olga, the floor is yours.
Good morning, good afternoon, dear colleagues. Thank you very much, Dr. Irina, for having a chance to be here with colleagues from all over the world and to have a chance to present national response for during the war. Can you give me the presentation? Have you seen my presentation? It's okay, yes?
Yes.
Thank you. Okay. For all participants, I would like to highlight the challenges which we faced and since last February, I mean since February 2022. If we are talking about general challenges, we have internal and external displaced people, and these figures are now around 7 million, including health workers, social workers. We have damages of infrastructure. As of now, we have 1,500 healthcare facilities which were damaged and around 200 which were fully destroyed. And if we are talking about funding, it's very important. We have a tremendous reduction of state funding due to reprofiling for military needs. If we are talking about program challenges which we faced since February 2022, we saw and we faced with disruption of all logistics routes, logistics of equipment and medicines, including drugs. We had challenges with returning of lost patients, provision of treatment for internally and externally displaced persons. We had risks of interruption for thousands of people who were on the treatment programs. We have risks of data losses because of hostilities, issues with electricity, and so on and so forth. And let's discuss about that during our presentation. If we are talking about sustainability, now we can talk about this because you see on the graphs there are two indicators. The first one, it's treatment by RT on HIV positive people. By the end of 2022, we had around 130,000 people on RT treatment, and you see that the figures, we keep this rate. And as of now, in the mid of 2023, it's almost around 120,000 on the treatment as of now. And we believe that due to displaced people, internal displacement, due to the enrollment of new people, we will have these figures around the figures of 2022. If we are talking about HIV testing, it's overall testing of key population groups, and we see that in 2022 we have a little bit decreasing of the figures for the testing. It's normal due to ongoing hostilities. It's very hard to provide medical services, but anyway, as of now, despite all challenges, the needs in testing increase, and you see on the graphs the figures for 2023, even we are in the mid of the year. If you are talking about expenditures, I have told already that the state budget was repurposed, but at the same time, thanks to all donors, PEPFAR, USAID, CDC, Global Fund donors, we keep our services on the same level, and even we increase. You see the funding, even during the war, we were able to procure some services within state budget. I should mention that prevention services for key population and services for care and support for HIV positive people before the war, since 2018, were procured by state funding and provided by state for state funds. If we are talking about coverage, you see on the right part of the graph the figures, and you see that the needs in services increase even during the 2023. We have a tremendous increase of the needs in the services, and we are able to provide even for donors funding, for partially for state funding, but we keep these trends, and we respond to the current needs of all key population representatives. If we are talking about tuberculosis, I should mention that Public Health Center is responsible for 4 national programs: HIV, TB, hepatitis, and for OST national program. That's why I should mention, because it's also should be reflected for you, that we see the numbers for incidence of active tuberculosis among the total population for 2023, the figures increased. If we are talking about effectiveness of treatment, for MDR-TB treatment, we see that in 2022 we even improve these figures, these trends, a little bit decreasing in effectiveness of TB treatment, but you probably know that TB treatment is not one-time service. It's a long process, and probably the patient started in 2021 were reported for figures for 2021. If we are talking about OST programs, on the left corner of the slide, you see the number of healthcare facilities in 2022 and in 2021, which that were provided OST for patients. We have tremendous decrease of number of healthcare facilities since the beginning of the war during last year, but even now we see that the programs are expanded, the new healthcare facilities opened and are opening still, and they provided more and more services for OST patients. If we are talking about the numbers, you see that we increase the number of people on OST programs in 2022. I should mention that OST is provided both within state clinics and within private clinics, and here on the slide are reflected both figures for private and for state clinics. And we see that the number and the needs are increasing, and we are timely responded to all the current needs of the key population and people who need OST. How we were able to keep these figures? I should mention that communication and open discussion are the key issues. Were and are the key issues. We have, since even the first days of the war, regular meetings with our donors, with Global Fund, PEPFAR, CDC, with all other stakeholders. We have very close communication with civil society organizations, with public organizations, with mostly all stakeholders who are in charge of OST issues. We very close cooperate with local WHO office in Ukraine, and we use their assistance, expertise in implementation of the national programs. Based on the Public Health Center, we have a working group regarding human rights barriers to access to services, and even this group were fully performed in 2022 and still are conducting these functions. And so the first news regarding barriers and probable changes are presented on this group, discussed, and is this a good instrument for new interventions or for reaction for challenges. If we are talking about PHC, I'm really very proud that we are working in Public Health Center, and I should mention that even despite the war, since the mid of 2022, we started to develop under the recovery of the health care system plan. We developed our own plan, not our own plan, actually country plan, but for HIV, TB, OST, and hepatitis programs. We have clear vision how we move, how we implement our next activities, and how we keep our programs. We restored the supply changes, and we developed new routes for supply changes. in order to ensure the continuity of patients' care in close cooperation with volunteer organizations, patients, civil society organizations, in all kind possible and even impossible moves. If we are talking about Global Fund, even during the war, we developed on the country level with all stakeholders the new program. We applied for the new application to the Global Fund for the next 3 years. Currently, we are implementing the current grant. We revised probably totally our previous and our current actually application in order to respond to the most urgent needs. Despite the ongoing missiles attacks, our staff members conduct visits to the regions, conduct on-site meetings, conduct in-phase meetings, even in shelters, because it's the best way to support local staff, to express how we rely on them, and to support them in general. Once again, if we are talking about a Global Fund, we had a very hot discussion, actually open discussion, in order to revise current our work plan and budgets, and for asking Global Funds to allocate additional resources to have all programs in place and to have sustainability of services. And we were lucky the Global Fund responded very positive and provide additional funding for emergency needs. Last autumn, when we have no light, we had no more lights that we had in the slide, but nevertheless, the new law on combating the spread of diseases caused by HIV and legal and social protection of people living with HIV were adopted, and last week the new law regarding the TB were adopted as well. Now we developed all bylaws documents in order to fully implement these laws. It's very progressive laws, very patient oriented, and very much responsive to the needs of the clients. And probably we are lucky or not lucky, but we as a public health center, as a key stakeholder for receiving all humanitarian and charitable aid for healthcare services. So that's why we try to do all the best to provide our facilities in all that they are need for their ongoing work. Coming back to OST program, we have a national strategy, and we have clear figures and clear targets within this strategy. So by the end of 2030, 40% from estimated numbers should be enrolled in OST program. And you see the goals for 2022, and you see the coverage in treatment for 2022. Even during the war, we increase the planned targets, and we enrolled more people in OST program. As of now, for 2023, we have more than 31,000, and as of today, even around 27,000 people are covered by OST programs. If we are talking about overall achievements, not only during the war, because it will be separate slides, since implementation of OST programs in Ukraine, we had quite a lot of achievements. Actually, the OST program is covered by medical guarantee programs, and before the war and during even the war, these packages are fully fully paid and provided to the healthcare facilities. So healthcare facilities have enough funds to provide OST programs to their clients. Digitalization, development OST module within our medical informational system of socially significant diseases. We started this implementation in 2022 and were successfully implemented even now. We expanding our OST through introduction in penitentiary facilities. We have, as of now, 5 healthcare penitentiary facilities that provided OST programs. We granted the rights to private healthcare facilities to OST implementation. We tremendously expanding actually the list of healthcare of OST providers. Now OST is provided not only by narcologists, but as of now OST can be provided by all trained doctor who pass the special course of OST treatment provision. We are very proud that as of today 96% of HIV positive OST patients who are HIV positive, they are received and still continue receive RT. We started and successfully, even since beginning of the COVID, we started to scale up take-home OST program as up to 90% of OST patients are enrolled in this model. We updated our standards according to the best practices. We improving the quality. We try to improve as much as possible the quality of services. We include alcohol aspects into the consultation and to the services for OST patients. We include mental health issues because it's highly demanded as of now. We introduced OST under video supervision, and we include hepatitis issues is treatment on OST sites. Once again, the number of patients as of June 1st, around 27,000 of people are covered by are enrolled in OST programs. You see on the map only one region of Ukraine is Luhansk region are not currently enrolled or performed programs by the OST program, but this region is fully occupied by Russia soldiers. And if we are talking about Crimea, the same. Even now, in all close to the frontline regions, OST programs are fully performed and implemented. Here you see the graph, the number of the average rate of RT coverage in the country is around 96%, as I have mentioned already, and you see on the graphs this rate from region to region, and we very closely monitor this rate. We are working very closely with doctors, even with patients, in order to provide adequate consultation for them and to keep these rates quite high. Challenges. Once again, what kind of challenges we faced during the war and how we respond to them. Limited access to places of storage of OST medications at the regional level. Disruption of logistic connections resulted in a delayed supply of medication. What we did, even if during the first days of the war, we extended the storage period of narcotic drugs in healthcare facilities up to 3 months, regardless of the license. and the relevant order of the Ministry of Health were issued, and we provide a lot of flexibilities in responding to the needs of the regions. We changed distribution model and delivery of medications to the regions, as well relevant order of the Ministry of Health were issued. And since the beginning of the war, during the last year and since during this year, it's mostly done in the manual mode, but regions are really very grateful because we respond very quick to their needs. They asked us for drugs, and even for the during the next 2 weeks we provided the relevant number of drugs to their regions. Destructions of damage of infrastructure I have mentioned, but anyway, despite that, doctors are provide OST to the clients. I should mention that during the first months of the war, when the delivery routes were broken, mobile clinics which functioned assist us very much in logistics of medications from national level to regional level and even to the facility level. Shortage of state budget funds for the procurement of medications. During the last, if I'm not mistaken, 5, 6, even 7 years, OST were fully covered by state funded and procured within state funds. Since the beginning of the war, due to repurposes of the funds, we asked our donors in order to cover the procurement OST medications and their support. We procured drugs on local production and with a good quality, and people, thanks to that, we keep all patients on the treatment, and we have no interruption in treatment. Even during the war, we got the donation of new OST medications, and as right now, the new drug Buvidal are implemented in the country, and we very close monitor the successes of implementation of this drug. Still, we have some challenges and we have no clear answers for them, but we are working very closely with national stakeholders, with Ministry of Health, with governmental and non-governmental organizations in order to respond to these challenges. Once again, open discussion and open describing of challenges support us to mitigate them. Since the beginning of the war, we conducted weekly briefings on OST for all key stakeholders, for patients and for service providers, for social workers and for medical workers. The more detailed information regarding our first response to the war, you can read in the article here. You have the link and the title of the article, so please go and read in very detailed description how we respond to during the first days and months of the war. But once again, I should mention that the war didn't start last February 2022. Actually, Russian war against Ukraine has been going for more than 9 years and 5 months. The war started on the 20th February of 2014 when Russia invaded and annexed Crimea. Later on, then partially Donetsk and Lugansk region were occupied by Russian Federation as well. since the 2014, more than 22 million of people were forced to leave their homes for internal displacement, for external displacement. According to the World Bank estimations, around 16% of healthcare facilities have been damaged or destroyed, and around $7 billion total healthcare losses they calculated by 2023. They calculated total losses around $16 billion. If we are talking about losses of population, Ukraine is among the 23 countries in the world that are about to lose more than half of their population by 2100. Decreasing of childbirth in 2022 comparing to 2021, which is about 20% in total. And we assumed and we really realized that these figures will be worse. If we are talking about budgets, the healthcare budget for 2023 covered only 74% of total needs. If we are talking in dollars, it's around $50 billion is the deficit for healthcare budgets as of now for 2023. Here on the slides, you see the pictures how we lived during last 15 months. We still continue to provide medical services even in the bomb shells. Our kids still continue their schools even in the metro station or in the bomb shell. But we are quite strong and we believe that we will survive. Here in the picture, probably you have heard that Russia destroyed military buildings, but actually you see on the picture it's a high-rise building in Dnipro where people in the night slept in their flats, and this building were destroyed by a rocket by Russia Federation. The winter was quite hot, and actually we now move into the autumn and to the next winter, and even during the totally blackout periods, we continue to provide services, to draft applications, to collect data, to keep our front line as a national OST program. The biggest challenge which we faced quite recently is emergency caused by the explosion of the Kakhovka hydroelectric power plant dam as a result of Russia armed aggression. I believe that we will have long-term perspectives, results of Russia's the occupation in negative word, but once again we here and we are quite strong to protect our rights. We believe in our armed forces. We believed in our people, and thanks to all world that support us and protect our Ukrainian nation, independence and Ukrainian nation well-being for future. Thank you.
Thank you very much, Olga, for your presentation. Thank you and Public Health Center of Ministry of Health of Ukraine for your work in this very difficult and dark time for Ukraine. Now our second speaker, Evgenia Zakrevska. Evgenia, the floor is yours.
Hello, everyone. Now I'll show my presentation. Sorry, do you see my screen?
Yes.
Okay, thank you. First of all, I want to thank you for organization of this webinar and for invitation. And the Alliance of Public Health for Public Health sends you our simple regards. So now, just a second. Sorry. Everything's fine. Yes. First slide. Our colleagues from PHC already provided information, some statistical information about opioid agonist therapy. So I will not stay for long here, but we have few slides about this information, and you may see maybe after this meeting, you may see the general data. I just want to show some comparison about situation before war and after the start of the war. On this slide, as you can see, situation before the start of the war, there were 218 OAT sites in Ukraine and in 25 regions. And now we have 207 OAT sites in 24 regions because, as Olga also mentioned, Lugansk region is temporarily occupied and OAT program is not working there. Also, the number of patients increased. It's very good situation, of course, especially due to the war. But still, due to hostilities and temporary occupation of Ukraine, 22 OAT sites have stopped their work, and 2 sites in Kherson and Mykolaiv region resume the work. So it's really good. And what else? Also about in a situation in prison, in penitentiary system. In penitentiary sector, 7 healthcare centers work in Ukraine for today, and about 170 people are receiving treatment. But before the war, better to say during the war, 3 sites stopped their work. Also, you can see here the number the number of patients, how dynamic of enrollment, and you may see how it decreased in the beginning of the war in February and in the beginning of March, and how it decreased in August when Kherson region was partially occupied. But in general, what is the most important, the OAT program has survived and its development. Next slide. I will tell briefly about programs, OAT programs in Alliance. Alliance have budget from different donors. We have several donors who support OAT projects in Alliance, such as the Global Fund, PEPFAR, CDC, Yale University, AIDS funds, and so on. And first of all, I want to tell a few words about programs that are covered by Global Fund. As you see, this is a list of activities, and I will briefly tell you about it. Psychosocial support of OAT patients. We provide such complex support for a long time, provided in cooperation with 22 NGOs in all regions of Ukraine. We provide such services like as counseling of patients, counseling of their relatives, provide psychosocial support, provide a counseling based on peer-to-peer principles, support for patients who have HIV positive status, who have comorbidity disease, support to referral to medical institution, and solving different problems which can arouse. Humanitarian support of patients. During the 2024, since the war began, Global Fund support us, Alliance, and provide additional funding. And it allowed Alliance to procure and to some humanitarian support and provide it to clients. It was food and hygienic kits. Also, it was some additional medical services, paid medical services, which were needed to patients. And for example, like magnetic resonance imaging and so on. It was very important for them on those time, and it's very important for now, but currently we don't have a budget for it, but Alliance is still looking for it to provide more support to our clients. Also, technical assistance. It's very important direction of work. It means renovation, opening of new OAT sites, repairs of existing sites, equipping. We provide such work for a long time, and also the same we provide in prison, in penitentiary sector. We Alliance support to open new sites, also provide some supplies of OST drugs and necessary equipment. Next direction, it was result-based funding. We provide support to healthcare facility. We pay for enrollment and retention of patients. Also transportation. Patient of OAT program to site to receive medicines. And the next activity is PDI, peer-driven intervention, involvement of hard-to-reach group among of people who inject drugs. And about psychosocial support. As you see on the slides, there are a map of Ukraine, and you may see how many people receive support. In total, minimum 6,000 people during the war received such support. It's approximately, for now, it's 28% for all number of patients, of OAT patients. And we provide such support in cooperation with NGOs, with 22 NGOs, on the basis of 112 OAT sites. And 147 case managers, social workers provide services. About technical support, as I mentioned, for many years, Alliance provides such support. And since the beginning of the war, we provided spot support if we received some requests from healthcare facilities. But I want to tell a few words about one case. This is a situation with OAT site in Mykolaiv, Mykolaiv Regional Center of Mental Health. You may see a picture on a slide. This site in the spring of 2022 was destroyed partially because of bomb flew nearby this site, and Alliance provides support and make repairs in new premise for OAT sites, and provides support for almost 450 patients who can continue to receive this treatment on site. But now this site was damaged again, second time during the war, and Alliance are providing support again. And we hope that now, for now, the site will be work normally, will be safe, but unfortunately we can't be sure because there are no guarantee about visit. So and it was information about 2022, and if we are talking about this year, Alliance provide extension support in the opening of new sites, rebuilding and repair existing ones. About provision services in prison, for now, as I mentioned, 7 OAT sites works in prison, and we will provide support. We are currently providing support to open 8 more new OAT sites. It's very important to expand OAT program in prison. About transportation, especially during the war, we Alliance provide transportation services during COVID and war restrictions, because there were some problems with transport logistic, some problems with funds, because some of our clients live far from OAT sites. Some have such disabilities, and it was difficult to them to get to the site. So Alliance provides support, and we provide transportation by taxi or cover expenses for public transport. And as you see, during the war in 2024, we provide more than 5,000 such transportation to most vulnerable population, and continue to do it in this year. For first 6 months of the year, it's more than 3,000 transportation were provided. By the way, as you may see on left picture, it's patients from one small site in small city, Dubno, in Rivne region. This site was closed during the war because there are no medical staff and some economic problems, and there were about 15 patients, and they have to go to other city to receive OAT. But it was really complicated for some of them. So Alliance, together with NGO, provides support. We hired a bus and transported these people to OAT site to get necessary treatment. Also, a few words I want to tell about RBF program. It was reformating, because if before the war we just provide support to healthcare facility for enrollment and retention of new patients, but during the wartime arose other problems. Lots of people have to move from occupied territories to more safe regions. And it caused an overload on some of OAT sites. So some sites, especially in the western of Ukraine, in Lviv, for example, or in Kiev, provided services to a much larger number of patients. But state paid just only for smaller quantity of patients in some period of the beginning of the war. So Alliance reallocate budget and provide support to these healthcare facilities who were underfunded by state. But now everything's stabilized, and state completely paid for all patients. And in this year, as we understand the needs of the war, the lack of budget, Alliance also made reallocation of funds and will procure a rapid pass test for psychoactive substances. It's very important to our clients, and also some part of budget will go for technical assistance for renewal of medical infrastructure. And briefly, a few words about activities in the beginning of the war. And we work together in cooperation with our dear colleagues from Public Health Center, who made just significant work. It was just a miracle of what did they do. And also we work together with our colleagues from Network 100% of Life. In the beginning of the war, where there were some lack of OAT drugs, in Ukraine we have two factories which provide OAT drugs, in Odessa and in Kharkiv. In Kharkiv, situation was very difficult. Factories stopped their work, and alliance with colleagues procured some drugs in Odessa factory. It was very important to cover needs of OAT sites in Odessa, Poltava, and Zaporizhia. And basically, our mobile vans, our like mobile ambulatories, delivered some humanitarian goods and also OAT drugs. By the way, basically, it's even not really legal, but it was very necessary. So in the beginning of the war, we delivered such necessary OAT drugs to OAT centers. What else? About humanitarian support, I already mentioned. Also, you may see here about certificate and note for OAT patient. Alliance, in cooperation with Public Health Center, developed such certificate. It's like general information about patient, about patients, where this patient receive drugs, and about all necessary information, because if clients face to military or to police, it can arouse some problems, and such certificate will help them in such situation. And about 10,000 certificates for 20 regions of Ukraine are already delivered. Next slide. It will be about work of our colleagues. This project are funded by PEPFAR. There are 12 PEPFAR regions in Ukraine for now, and we provide services in 3 of this region: Kirovohrad, Dnipropetrovsk, and Zaporizhia Oblast. Provide support of healthcare facilities during the war, provide some support for introduction of innovative services, for work of mobile vans. And about these mobile vans, mobile clinics, it's like a pilot, and we're still waiting for some, still waiting for some orders from government to start work normally, but for now, this clinic provides services can provide OAT drugs to patients who take medicines on home-based hospitalization treatment, who have some disabilities and can go to hospital, to OAT sites. And these services are provided in Kiev, Kropivnitsky, and Odessa. But not only such services, also this is psychosocial support, diagnostic and testing on HIV, TB screening, providing ART, Hep C, and antidepressants. Also, in cooperation with our other project who works in HIV program, we provide work together and redirect patients with HIV status who is from among people who use drugs to OAT programs. It's also very important, especially during the war. Also, we support the work of website and mobile application. It's really important application for doctors, for patients, for people who use drugs, and for other all stakeholders. You may see a link and QR code, and you may use it and find a lot of information necessary orders, recommendation, especially orders which were provided during the war. You will find contacts of medical institution and other useful materials. About national hotline on drug addiction and opioid agonist treatment. We also support the work of this national hotline. This hotline provides different services. They protect rights of OAT patients, provides legal support, especially during the war. It was very important to understand for patients where to go, in what regions they can continue to program, where they can find OAT drugs, because it was very difficult situation in the beginning. It was such a mess. Nobody knows what to do, where there were places for them, in which healthcare facilities. So a hotline provides such information. Also, you may see the story of one of such client, and this is Karina. She is a social worker, and also she is a client of OAT program. And she, the beginning of war, she met in Kharkiv with her mother and her son. She lived in metro station for some time, and after that moved to Dnipro, and now she also provides support to OAT clients. And if it's interesting for you, you may see her story. It's really interesting, especially to understand how difficult it was for our patients during the war, especially during the start of war. And once more, our activity, our project, it's Help Now Hub. It's supported by Alliance for Public Health and Alliance Consultants, founded by Global Fund and AIDS Fund. This hub started their work at the beginning of the war and provide different information for key population group, especially information, navigation according to human needs, ensuring uninterrupted provision of services, the prevention and treatment of HIV, TB, and harm reduction, OAT programs. For now, more than 28,000 cases were supported by the team in almost 40 countries, because our patients have to move abroad to safer places. And for now, such hubs are providing services in Poland, also in Germany, in Baltic countries, and also in Moldova. But in Moldova, they are working separately. And if we are talking about OAT, 1,700 requests were supported. So it's also information very needed, because it's not really easy to patient find some place abroad where they can continue treatment. And this is general data about Help Now. Also, we Alliance during the war provided scientific work. This work provided our colleagues from project who are funded by Yale University. You may see different scientific articles, and if it's interesting for you, here are links for these articles. Also, I'll be finishing because I know that it's not much time. About problems, of course, we have some problems, especially because due to the war, due to hostilities, this is destruction of medical infrastructure, insufficient funding, lack of qualified personnel, medical personnel. And it's really a problem for now, because lots of medical personnel have to move. Somebody moved abroad, somebody unfortunately died. And for now, it's really important. Also, we have problems of quantity of OAT sites, of expansion program in prison. Some still there are some myths about OET program. There are still stigmatization. So we will continue to work on it, to support, continue to provide support to patients, to provide support to healthcare facilities, to expand program in OET program in prison, expand mobile services, provide trainings and supervision on scientifically based methods, and so on. Also, next 2 slides, just pictures of our patients, about pictures of our work. And contact information, if you will have any questions after this meeting, you are welcome to send it to me and to my colleagues. I thank you very much for your attention.
Thank you very much, Evgenia, for a interesting presentation, for your work and work Alliance of Public Health. Unfortunately, we haven't a lot of time for questions. We receive a lot of questions, but I would like, I will send this question to our presenters and ask to respond by email. But now I would like to ask only one question for both our presenters, Evgenia and Olga. What do you think? What are your greatest achievements in helping people who use psychoactive substance during the war? The greatest achievements during this period?
If I can answer, thank you, Irina, for a very interesting question. I should say that the biggest achievement for us, and probably for the whole stakeholders for working with OST, is the fact that people are on the treatment. Treatment were not interrupted, and still, despite the war, we increase the number of sites, the number of people on OST, and we have enough treatment in place, and even the buffer treatment that we can provide to all who need this treatment. Thank you.
Thank you very much, Olga. Maybe Evgenia.
Of course, I'm totally agree with Olga. Difficult to say what can be the most, but probably the main that we didn't stop. We provide services, we are providing support, and OET programs survive in such difficult situation, in horrible conditions of war. So I think it's the most important for us, just to provide support and continue to do it.
Thank you very much, Olga. Thank you very much, Evgenia. I will send all the questions to you, and we ask to respond by the email for our participants. Also, I would like to thank for participating in our webinar. Special thanks our technical support. Thank you, Olivia. Looking forward to meeting you soon at the next event. Take care and stay healthy. Thank you very much.
Thank you.
And stay safe.
I wish you all the best.